Welcome, everyone. Thank you for joining us today. My name is Nick Boehringer. I'm a youth activation specialist with Ashoka, based out of Washington, D.C. Welcome to this Ashoka U Exchange virtual session called Changemaking for Health, featuring one of our amazing partners, Boehringer Ingelheim. The co-hosts for today are going to be myself, Danielle Loosbrock, who works for Boehringer Ingelheim. She's a senior associate director, as well as two amazing young changemakers, Laia Allemande Chile and Jessalyn Wan, who are going to talk a little bit about their Changemaking for Health projects. Let's see. I think we have a small enough group that maybe we could introduce everyone on the line too real quick. If you could just tell us what your name is and where you're calling in from, that would be wonderful. Laia, do you want to start?
Sure. Hi, everyone. My name is Laia, and I'm from Austin, Texas.
Hello,
Wonderful.
everyone. My name is Jessalyn Wan, and I'm from Clifton, New Jersey.
Great. Thank you, Jessalyn. Alexandra, could you introduce yourself, please?
Sure. My name is Alexandra, and I'm from Queens, New York.
Wonderful. Thank you for helping us out today.
For sure.
Over to you, Danielle.
Yeah, my name is Danielle Loosbrock. I work for Boehringer Ingelheim.
Great. And I see Rachel on the line.
Hey, I'm Rachel. I'm out in Portland, Oregon.
Great.
Over to Tia. Portland.
I'm Tia. I'm also from Portland, Oregon.
Welcome,
Very
Tia.
Cool.
Swati.
Hi, I'm Swathi. I'm calling from Washington, D.C.
Wonderful. And I don't see, I'm sorry, I'm not able to access the names of our other two participants.
Yeah, hi, I'm Eddie Gonzalez.
Eddie.
I'm calling in from Queens, New York City, but a local of, grew up in Corpus Christi, Texas. So good to hear Austin's represented.
Great, welcome, Eddie.
Patricia, I don't think you've gone. We can hear you.
Yeah, go ahead.
Oh, yeah, you can hear me. Sorry. Hi, I'm Patricia, and I'm calling from Mexico.
Oh, wow.
Yeah.
Welcome.
Thank you.
And our last participant, Sen Yao. Are you on the line?
Looks like they might be on mute.
Hi,
Oh,
I'm Sen Yao. I'm calling from China.
Wonderful.
Nice to have you.
Glad to have you.
But seems like my network is not very stable.
Got it. No worries. All right, so we'll dive right in. So today our session is the Changemaking for Health session as part of the Ashoka U conference. And as I said, it's brought to you today by Ashoka, who I'm going to talk about the organization in a little bit, and then Boehringer Ingelheim. And you know, the main concepts that we want to explore today are how changemaking intersects with education and higher education, with the particular lens of changemaking for health. And we're going to talk about the Making More Health program that has been a partnership between Ashoka and Boehringer Ingelheim, and how through this program we've been trying to bring changemaking into classrooms around the country. So to start off, let me just tell you a little bit about my organization, Ashoka. We have been around for about 40 years. We were started by Bill Drayton, and probably the thing that Ashoka is best known for are our Ashoka Fellows. And these are a network of amazing entrepreneurs, social entrepreneurs around the world that are really changing their society by bringing this systems changing ideas to their societies and countries around the world. And one way that we like to talk about social entrepreneurship, which was, you know, a concept that Bill Drayton and Ashoka really helped to mainstream into into kind of the global vocabulary. One way we like to talk about this is this quote from Bill Drayton: "Social entrepreneurs are not content just to give a fish or to teach how to fish. They will not rest until they have revolutionized the fishing industry." So our Ashoka Fellows are social entrepreneurs that have kind of big systems changing ideas to address issues that are kind of all issues in all fields around the world. And we've brought them together into the world's largest network of social entrepreneurs to help to support their ideas, to help them to grow. Around 20 years ago, we started initiatives around bringing what we call change making to youth and into the education system. And just to differentiate from social entrepreneurship and a social entrepreneur, we define a change maker as anyone who takes action to address a problem or create an opportunity for the good of all. And this came out of a couple of insights that we were came up through working with the Ashoka Fellows. One, in that, you know, we're finding that most of these Ashoka Fellows who are, you know, in their professional careers, they started a pattern of creatively addressing problems from a young age. And, you know, as we at Ashoka are looking forward, and particularly in this current time where we're seeing that the rate of change and interconnectedness is accelerating around the world. We're certainly seeing that with the recent COVID-19 pandemic. We are realizing that the tools and mindsets and the skills that these social entrepreneurs have need to be brought into the education system so that young people can practice those from a young age to complement the current education that they're getting. So on our education side, we're trying to, one, change the way that society views young people as important co-leaders to address issues that are currently happening. And then we're trying to get young people and through the education system, within and without the education system, to begin to practice these change maker skills, which are going to help to address those current problems, but they're also going to help prepare them to be successful in a world where that is more and more defined by change. So our overall vision is a vision where every young person identifies as a young change maker. And to help bring about that vision, we partner with organizations like Boehringer Ingelheim. And in this particular partnership, we're focused on bringing change making into education and how it intersects with health. So I'm going to pause here and I'm going to turn the mic, as it were, over to Danielle Loosbrock from Boehringer Ingelheim, who's going to say a little bit more about the Making More Health partnership. Danielle, over to you.
Yeah, so Boehringer is the largest family-owned pharmaceutical company in the world. We also are the largest vet medical company in the world. We make medications that improve pets' lives and people's lives. And so the family members, the Boehringers of Ingelheim, Germany, they had a connection to Bill, who started up started up Ashoka. And so essentially we partnered with them around the areas of health and health improvement. And that definitely incorporates pets into the mix too, because they're increasingly becoming more important in, especially in developed countries. But we do a lot of work in underdeveloped countries in bringing health and safety to the communities, and sometimes that's focused on the animals that are there as well. The reason why we decided to partner is we're passionate about improving health worldwide and globally. That's why we are in this business. And so one of the things that we saw an opportunity for in connection with Ashoka was to really highlight and help support those working on improving health or community health across the world. And so the focus for us is on helping with social innovation, creating co-creation opportunities between business and social entrepreneurs, really kind of highlighting and supporting change makers in the community. And for us too, it's also contributing to culture and knowledge within our own organization around entrepreneurship, as well as innovation and creative thinking and creative thought. Sometimes when you operate in one kind of environment for a long time, BI has been around for 135 years, you get a little stale. And so for us, it was a really great way to give back to the communities that we serve and highlight talent delivering novel solutions in the marketplace, but also to give our employees a way to contribute and also spur that innovation component, so that we can be better at our own jobs in our for-profit businesses as well. So those are the kind of areas. The Making More Health Fellowships specifically that we support 87 different fellows across 37 countries. You can kind of see how they're scattered across the world. But what we're really proud of is that number at the bottom in terms of number of direct beneficiaries. We really believe that this partnership has benefited not just the fellows, but it really benefits BI to be in collaboration with these, entrepreneurial people who are really trying to change, change their world. And so we want to be part of that, and we want to help support that. To give you an idea of some of the folks that we support Josh Nesbitt. Josh created this really awesome platform called Medic Mobile. And one of the reasons that I love this, I grew up in rural Indiana. I went to the second smallest public school in the state of Indiana. I graduated with 44 other people. I'm really not that old, just to give you a sense, but it's really hard to get healthcare in rural areas, even in the US. So Josh saw an opportunity to use phones in a lot of developing countries, even though they may not have Wi-Fi or a physical phone in their home. A lot more individuals are having mobile phones. They're not smartphones necessarily, but there are ways that you can leverage the text platform to really help people find healthcare when they're kind of isolated in these rural locations. And so he is now working across 13 countries that started with a pilot in Malawi and now has over 30 partners and 2,000 community health workers who use his platform. It's just one small way that you can see the impact of one person with this crazy idea can really have an impact with broadly across the world. So we're really proud of the work that Josh has been doing. We're also trying to figure out how we can use it in the US. Morgan Dixon, Girl Trek, is fantastic. I got to meet Morgan in person. Basically, Morgan's concept was, African American women kind of drive the communities, health of their communities, and they're disproportionately affected by, obesity-related and preventable diseases, and often, what the statistics would say are they're dying at higher rates compared to other groups or other groups within America, especially within the female communities. And so her idea was, well, why don't you make a commitment to walk together? So gather your friends, and make a plan and just commit to daily walking so that you can increase your activity rate, rates of activity or your steps. And also it helps to create this peer culture and support for healthy decision making. She has worked with over 20,000 different walkers across the US, and has inspired a network of 175,000 different supporters in more than 120 cities across North America. She came to Detroit and helped us out. I'm in Ann Arbor, Michigan, go blue. Even though I'm wearing a Vermont or a VT hat, I actually am getting ready to go back to school at the University of Michigan to work on health. So she does great work, usually in urban centers where there's a large African American population, and she's just infectious. Like when you talk to her, you can't help but get excited and want to go on a walk with her. So, and she's doing it just by having conversations. And then there's also Edith Eliot out of Nora Health. Nora Health actually inspired a program that we created within BI, and I'll tell you more about that after I kind of explain what Nora Health did. Nora Health, the leaders there, Edith and others, were looking at a way to help in urban centers really decrease the amount of, or increase the amount of education by really getting caregivers into the mix, especially in societies where family relationships are the support and the foundation of health and community. And in India, this is a particular problem. There are more doctors, and they have more need beyond the doctors that they have, and they need more resources. But one of the problems is they just don't have enough resources. And so what they noticed when they were walking through hospitals in India is patients would be gathered in hallways with their family members, sitting, waiting to see the doctor, or waiting to get their test results or whatever. And what they decided is couldn't we use that time while they're sitting in the hospital to educate them around their disease states and improve their health, but not just educate the patient, like also educate the family members, because a lot of times it's the family members who really motivate the individual to take better care of themselves and kind of keep on top of their health. And so their idea was like, let's turn all of these hallways into almost like schools or classrooms so that they could do education, and do that with other peer group mentors, so that it doesn't cost. You don't have to have a nurse deliver this care. So now they are operating across 8 different cities in India. They've trained more than 7,000 family members. And what is really, nice about this example is they've actually started tracking the impact on, reducing the burden to the healthcare system. They saw a 36% reduction in post-surgery complications, which is really fantastic. That means people aren't going back into the hospital for those complications, and a 22% reduction in hospital readmission just by having conversations in those hallways, using that time that was available anyway. And Nora Health, when we learned of this idea, what struck us in the US, I work in the US for BI in health economics and outcomes research, and what struck us was, wow, there's a real need, especially in the US, to have culturally sensitive education and really understand, where the family is important, and how to communicate with different ethnic groups, and be culturally sensitive. So we took the idea of kind of transforming the way we talk about health specifically in South Asian communities in the US. South Asian communities are at a more elevated risk for diabetes and cardiovascular disease. They don't present to the doctors in the same way that other Caucasian or other ethnicities do, and they don't have abdominal fat, so they can look really healthy but be really sick and on the verge of having heart attack. And so we recognize that this is a unique problem, not just within the US, but across the world. And we found an individual within the Advocate Health System in Chicago Dr. Siddhis Pawala, he heads up the South Asian Cardiovascular Center. And when we partnered with him, he was one of my customers. And when we were talking with him, we were thinking about Nora because he's Indian, and he deals with a lot of Indian patients in his South Asian community. And he helped us understand some of the issues there. And then he also said, well, you know, what I really would love to do is make some videos to help South Asians understand how to cook healthier, eat healthier, understand their own risk, understand the importance of getting in early with your physician and talking about your issues, and not just assuming that you're healthy, and using a culturally sensitive way to do that. And so we partnered with Advocate to produce, and the South Asian Cardiovascular Center to produce 25 different videos, short 90-second videos on health education that are culturally sensitive to the South Asian communities that we serve. And so we have products that help reduce cardiovascular risk and diabetes and cardiovascular disease. And so for us, this was a really great way to reach out to a community that we knew was underserved and really try and be more to them. And we did that because we had talked with Nora Health and learned of these new novel ideas. It was a great, you know, spark of light that caused us to really seek an opportunity to you know, have an impact in the US specifically. But I believe those videos are going to be used across India as well. So.
Thank you, Danielle.
Yep.
So in a few minutes, I'm going to change the format of this to put us into breakout groups. And I really want to talk more about what's currently happening around the world. We actually, you know, we set up this session to be a Changemaking for Health session before any of the COVID-19 news broke. But certainly as that was happening, we were recognizing more and more of a need to be having these discussions around the world on how individuals and groups can take actions to address issues that they're seeing personally in their families and their peer groups in their communities. But before we move into those breakout sessions, I wanted to introduce some special guests. So we have Laya Allemande Chile and Jessalyn Wan, who are two young changemakers who have Changemaking for Health projects. And I would love to just invite the two of you to kind of introduce what you're doing and maybe start off with the need that you saw in your community. And then maybe just briefly tell us a little bit about the Changemaking project that you've developed to try to address that need. And maybe Laya, would you mind going first? I think you're muted.
You're right, I was.
Thank you.
Yeah, I'd love to go first. Especially living in Austin and Texas, we have a lot of low water crossings that are very prone to flash floods. And that's especially true because of the super hilly terrain that exists, especially within Austin. And so in June of 2016, one of our community members was actually driving in a pickup truck at night on a low water crossing. And he was swept away and drowned that night due to the flash flood that had happened. And, you know, I hadn't heard of too many incidents like this, but after doing some more research, I found out that it wasn't an isolated incident and that many other community members' lives had been lost due to flash floods. And even some safety workers and firefighters, police officers had also lost their lives trying to monitor these crossings and try and prevent people from losing their own lives. So this kind of inspired me to look into the process and kind of figure out why exactly there wasn't a system that could prevent deaths like this from happening. Low water crossings are so abundant in Austin. I knew there had to be some way to be able to prevent these deaths from occurring. So I did some research and I figured out that the city solution that was implemented cost almost $10,000. And because of that, it was only deployed at a few of the low water crossings. And because of that, the people weren't getting alerts. It wasn't an efficient enough system to send alerts to community members and emergency response personnel. So I decided to see if I could do something about it. And after doing a lot of research, I was able to develop a solution that has a physical component, and it costs under $50, and it's able to be deployed to any low water crossing that's necessary. And it's able to measure water levels and send alerts to community members and even emergency response personnel through a mobile app, which is currently deployed on the Google and Apple app stores. And it's also able to send text messages if necessary. So that was kind of my, I guess, reasoning behind creating the project. And it's currently actually deployed at a low water crossing in Austin through a collaboration with the city. And it's been working successfully for over 2 years now. And they've been using it during storms like Hurricane Harvey and other hurricanes. And it was able to be of great use to them.
Wonderful. Thank you so much for sharing, Laya. And let me just add that Laya is part of the Ashoka Young Changemakers program that is supporting a group of young changemakers around the country. And though these amazing group of young people is also helping us to co-lead the Everyone a Changemaker movement. So supporting them not just on their own amazing ventures like Hydro Alert that Laya just talked about, but also in empowering other young people to become changemakers. And with that, let me introduce Jessalyn Wan. Jessalyn was part of the Making More Health program through a class at the University of Connecticut around social entrepreneurship and change making specifically for health. And as part of that class, students got into groups essentially around issues that they were seeing related to health in their communities that they wanted to try to address. And they spent 2 semesters developing and prototyping those ideas. And Jessalyn was part of the team that won a pitch competition that happened at UConn in March. So welcome, Jessalyn. If you could start kind of the same as Laya, let us know what the need is that your team saw and the idea that your team came up with to address it.
Yeah, so the problem that my group and I wanted to tackle was food insecurity within our local community, specifically the town of Windham, which is right outside of Yukon. And we believe that this town would definitely benefit from our program because 25% of the residents live in poverty and 80% of the students are eligible for free and reduced meals. And so what our program is called is Kid Kitchen. And it's a mentorship program that connects college-age students with middle school students in order to promote and teach nutrition while also making sure that these students do not go home hungry. And so we would meet at local community teaching kitchens, specifically Click Kitchen, which is a community teaching kitchen right outside of Windham. And so the college students would cook healthy and easy recipes in hopes that these skills would translate to the middle school's children's home life. And this program will focus on nutrition education as well as gardening in order for the students to learn about sustainability and to have access to fresh ingredients. So yeah.
Sorry, I'm trying to unmute myself. Thank you so much for sharing, Jessalyn. I hope that, through the Making More Health fellows that Danielle introduced, as well as these stories, hoping to start to inspire the change-making energy in all of us, hearing some examples. And what I wanted to move next to was to thinking about the broader context that we're operating in today. I wanted to open it up to the group. Oops, let me go to the next slide. To talk about and to hear from people about any change-making responses that people have heard about that individuals are putting into place to address some of the issues that are coming up related to the current pandemic going around the world. So I'll open that up to the group. Does anyone have any innovative change-making for health that they've seen that they'd like to share?
Well, I can start.
Yeah, please.
Our neighborhood in Ann Arbor, so it wasn't led by me. I had nothing to do with this, but our neighborhood recognized a couple of hospitals who were out of masks. Everybody knows that there's a PPE shortage. And so what we decided to do as a community, we have some retired folks who like to sew. And so we organized within our neighborhood, just my local neighborhood. It's like 5 blocks, you know. We organized working with some of the local craft stores to get some material for free. And then we actually put together a sewing group where where we socially distance ourselves and isolate ourselves, but we actually sew together, sometimes online and sometimes on the phone. And then we'll drop things off so that others can take them to the hospitals in need. We checked in with the hospitals to make sure that we had the design right, that we were using something that was, you know, going to be actually useful. But so far we have delivered over 3 dozen masks to our local hospital. We're still making them, but you know, it's been a local community effort, and it wasn't something that I would have even thought of doing. I like to sew on occasion. You know, my mom taught me when I was young, and my grandma really liked it a lot. So so I thought, well, I have this old sewing machine, I should just whip it out and you know, at least make myself useful with all this extra time. So that was, you know, one cool thing that has happened in my community.
Yeah, thank you for sharing. That's amazing. Anyone else? Anything that they have participated in themselves or just they've heard about happening around the country or around the world?
I think in general, like the online response just to kind of keep people connected has been pretty awesome. I know that a lot of people across communities, whether it be on Instagram or YouTube, have been, for some people, making sure people are staying healthy and fit and conducting free online workout sessions and doing live streams. I've definitely participated in a few of those from home. And then I also think in general, like emotional support, I know that a lot of people, especially on social media too, have just been posting, saying, you know, if someone wants to have a conversation, they'd be open to do that. Wellness groups and apps opening up things for free. There's definitely been a lot of response like that from organizations. And then to kind of build on what you were saying about the masks in Michigan and your community, I was doing some research kind of about like efforts across the country to help out. And there is a university, I believe, that actually was kind of, I guess there were kids there, both students and professors, who were pretty adept at using 3D printers. And they actually came up with a template for anyone who has a 3D printer to actually print masks, assemble them, and then send over parts or masks, and they can send those out. So I thought that was pretty cool. I'm looking into doing something like that at my school, trying to see what I can do, because I know we have a couple good 3D printers. So.
Yeah, that's a great example. I think I heard about that through New York, actually, in the I think it was in Brooklyn or the Bronx, and a colleague of mine lives there, and so she sent it out, and we actually individually, not BI, but like our team, our East Coast team, we contributed online to help support, you know, resources, you know, buying supplies. So that was cool.
That's awesome.
Yeah, great example. Thank you. Anyone else? One more? Anything that you've seen?
I was going to say, kind of going off that, another thing that I've seen is that I thought was really cool was a kid who, I think we all know that masks, when you wear them, they can chafe the back of your ears, especially for healthcare providers. And so a student came up with a really cool, like simple design that's now open source for 3D printers. That's like a band that goes kind of across the back of the head. It's like simple, it's effective. He saw a need and he filled it. I thought that was really cool. I don't know if I'm describing it well, but basically it pulls the mask back off your ears to give nurses and doctors a little bit of relief.
Yeah, so cool.
Yes, thank you.
I can add one more.
Yeah, please.
I work at a strange intersection, especially around spiritual care and media, sort of like audio and audio content mostly. And one thing that I've loved seeing has been, well, in part, the need or the problem has been that there is a lot of attention given right now to the health needs and the immediate health needs that are arising from COVID. But alongside that are, of course, a lot of grief, a tremendous amount of say emotional and spiritual needs that start to arise out of what's coming up. And some of the chaplaincy networks that I've been involved in have been looking at ritual design, especially as it relates to being remote, and have brought in folks that are doing ritual design along with like funeral directors and then communities of chaplains to figure out ways of doing something like funerals or areas where folks can gather to share their grief in a moment when we can't be in person. And then we've also seen, just from our media company, a chance to gather content that can act as a way of providing like a care package and provide some sort of like mental and spiritual support for healthcare workers, spiritual care providers, and also for families that are going through this.
Very cool.
Yeah, thank you. That's a good kind of transition to what I wanted to cue us up next to talk about, which are, in this time of such a tremendous amount of change and uncertainty that is touching every community and family around the world, there is so much opportunity to address some of these needs as change makers, and to start our own change maker journeys or to spark the journeys of others. So, and when we're teaching this, like asked Laia and Jessalyn to do, we often start with trying to think about, what are some of the new needs or issues that are popping up, so that we can move from there to try to think of some ways to address those. So what I'm going to do next, I'm going to ask Alexandra if she can put us into some breakout groups so we can start having some more conversations as a part of this session. And what I'd like you to chat about for just about 4 minutes is thinking about, from your particular lens in your families and communities and online peer groups, social media, what are you seeing? And Eddie, that was a great example from your particular vocation, but I'd love for you to chat about where is change making needed in your specific context. What are some of the issues that may be directly health related, but maybe just some of the issues that are stemming from the health pandemic or the isolation caused by it that are popping up that could potentially use change making solutions. So Alexander, if you wouldn't mind doing that, and just put us in pairs, please. Hey, everybody, welcome back. I hope that was a good discussion. I think we're still waiting for, oh no, I think it brought us all back. Before we move on to the next question, does anyone have anything that they want to share that came up that what they felt was insightful during their conversation?
I can go. Laia and I talked
please.
a little bit about just the gap now with online learning and like the gap that's needed with students and teachers and how young people or peers can step in to be tutors virtually, or what roles that could open up with different opportunities for support and peers. And then also with that, the social isolation, the aspect that comes with living remotely, and how the need to kind of utilize our change-making skills to step in and support others.
Yeah, that's great. Thank you.
Yeah, I would hop on that. As a parent of 3 children, one in high school, one in middle school, and one in elementary school, they are driving me crazy. They just need somebody to help them focus, and it can't be me all the time. So that's a wonderful idea. I hope somebody does that.
I agree.
Thank you. Anyone else want to share needs that they've seen that have come up?
Sorry, I realized I was just muted. I can share quickly. I know, Nick, you teach and you notice some of your students not having capstone projects. Things are getting canceled. And for me, in addition to working, I'm also a graduate student, and I just had a similar thing happen to me. But finding ways to capitalize on kind of, while one door might close, there are so many needs and so many places to be able to help in this current context. So, encouraging that and fostering that, I think is really important.
Yeah, wonderful. Thank you. And you mentioned one thing that I've been seeing is having students that are completing high school and have scheduled internships or other capstone projects that aren't possible anymore because of the quarantine. So I've been kind of connecting with students to help them to try to navigate change making as an amazing alternative to have a project that kind of fulfills those educational needs and also allows them to develop this set of skills that'll hopefully be useful for whatever they go into. I'm going to move us along. We have about 10 minutes left. We're right on time. We'll be finished by 12. But in that last 10 minutes, I want to kind of redirect us to reflect kind of on our personal change-making journey and on the change-making journeys of the people around us. So I want to give people just maybe 45 to 60 seconds to think about what was one time in their life that they feel like was a formative change-making moment for them. And maybe this was during somewhere in their education or more recently or in their professional career, but what was a time where you as an individual noticed a need that was coming up in your community or workplace or school and took some action, big or small, to try to address that need, and kind of felt that power to make change that the change maker kind of embodies. So I just want to give everyone a few seconds to think about that. Everybody feel like they have something? And this, like I said, this can be something very small, but just looking for some moment that we can kind of focus on where you felt like you made a difference. And what I'm going to do is I'm going to ask Alexandra to put us back into the breakout groups in a second. And the question that I want you to talk about is, as we're thinking about our own changemaker journeys, I also want us to think about how can we spark and support the people around us to also be addressing any issues that they're seeing coming up and to kind of be empowered by that changemaker set of skills and identity. So the question that I'm going to ask you to discuss just really briefly was the moment that you were thinking about where you felt like you really had the power to take on issues that you were seeing. I want you to just take a couple minutes and just with that person discuss who was the person that supported you in that moment, or what enabled that moment to happen and how they supported you. So Alexander, if you could give us just like 3 minutes in breakout groups, we'll do a really quick discussion around this particular question. All right, welcome back. Let's see. So I hope that was a good conversation. We are running short on time, so don't have a lot of time to debrief, but wanted to kind of end with a little exercise before we do. So during this session, we've talked about change making and its importance in the lives and education of young people. You know, in particular during this time of change and upset and the pandemic that's going around. As we talked about, there's so many issues that need to be addressed. We really need everyone to step into this change making role. And beyond that, I think, you know, we need everyone to step up to be a change maker, and to get there, we really need everyone to be helping the people around them to also identify as change makers and to start these change maker journeys. So as we end today, I want to make it really personal with a challenge to all of us. And to do that is kind of 2 steps. The first is, I'd like you all to just to think about a young person in your life, somebody specific. Everybody got that person? Wonderful.
Yes.
And, you know, like in the example I really love that Danielle shared with the initiative to start manufacturing masks and bring them to the hospital. It wasn't just that one person who had the idea and did that. They really got their community involved in that effort. It started, a chain reaction. That's all of the people that project touched may, have their own ideas that they're going to pursue and bring other people into this movement of change making. So as we close today, I want to ask you about the combination of those issues that we talked about that need to be addressed, that we're seeing in our communities, the young person that you talked about, that you identified, leaving you with the kind of the parting challenge of what might you do to spark or support this young person's changemaker journey during this critical time? And a lot of times, that starts off with a conversation, I think all the time. And it's something that I've been trying to do with I don't have any kids, but my nieces and nephew, to try to get them to think about, their own place in the world at this time, and to think about what the problems that they're seeing in their home or with their peers, and to think about what are these really small actions that can start off this amazing journey that many of us have been on, that certainly we see in Laya and Jessa Lynn, to start off this pattern of change making, right? Change making isn't about any individual project or action, but it's a pattern of behavior over the course of a lifetime, which not only helps society, but also helps these individuals to thrive and adapt to whatever the world comes up with next after the COVID-19 pandemic. So any closing words as we end here? Ideas for sparking or supporting young changemakers' journey, or just anything that you found useful about this webinar?
This has been great, Nick. Thank you so much.
Yes, it's been lovely to meet all of you virtually. I hope you continue on your changemaker journey, and hopefully our paths will cross again someday.
Yeah, and so exciting to look at what's going on from this broader change-making lens. It's been refreshing.
I think so too. I know that so many of us feel overwhelmed during this time and kind of powerless in the face of such a global force that we're feeling. But I think bringing the change-making lens into it and really trying to empower individuals and trying to empower groups and communities to make change where they are, at least for me and kind of the students and adults that we've been working with, has been just I think, like Tia said, a really kind of refreshing way to think about it and to feel like there's, we're all able to make a difference wherever we are, even if it's just with a small action. And whether it's us or whether it's empowering someone else to take action, both of those are really important steps to keep things moving forward and on a positive note. So it's 12:02. Thank you so much, everyone, for joining us. I hope you have a lovely Thursday. And please check out the rest of the amazing sessions that the Ashoka U Exchange has going on over the course of the next 2 days around bringing change making into education.